My name's Keith. I have essential tremors. I work in orthopedics. Before my tremor started, I used to go into the operating room, help with surgical procedures, and unfortunately, I'm not able to do that anymore. Well, the first time I started noticing the symptoms, I was a sophomore in college, played a lot of basketball. I was really active. I'd go out and do a lot of running. Once the tremors started progressing, you could just see everything just starting to decline a little bit. I decided to get the procedure done because you can't do anything. You can't eat, you can't write. Every time you pick up a glass of water, it's all over the floor. Or you try feeding yourself and you got food all over the table. You know, you kind of start isolating. Don't go out to dinner, because you're just paranoid you're going to make a fool out of yourself. No, it was time. You think there's no way anyone is going to be drilling a hole in my head and putting an electrode in there. Well, I got it done. And it's the best thing I ever did. That part, the part I was most scared to death with, the hole drilling, didn't even feel it. It was nothing like I was thinking it to be. The procedure itself was easy. The surgeon that I went to, he basically gave me some options, and the Abbott DBS system is the one that we thought was going to work the best for me. After I had my procedure, they brought me up to the ICU, and I picked up a glass of water, and it just went like this, and I'm just going, oh, it's gone. It's absolutely gone. Then I'm just thinking, why the heck did I wait so long? My surgery was November 30th. I was out 3 weeks and went back to work 100% normal. Since I had the procedure done, I don't take any medication. It's mind-blowing. And this DBS system absolutely did what I wanted it to do. I can write, I can eat, I can drink, I can do whatever I want. You're not self-conscious anymore. You go in for 2 program settings, 4 or 5 weeks after my surgery date. Met with a nurse practitioner, and she went through the whole programming cycle. And she set a range from 1.50 being the minimum up to 2.0. And I can actually control the device with an iPod. It prompts you on exactly what you have to do. And then when you're done with how you want it set, you just turn it off, put the iPod in your pocket, and away you go. My plans for the future are to get my other side done, to get the same results that I had with my right side, and in terms of my work, to get back in the operating room. I think what I would tell people if they were considering to have this done is, I was just like you. I know you're anxious, scared. You just wake up one morning and say, let's go, I gotta get it done. You'll know when to get it done. I'd recommend this to anybody. Bring them in. I'll tell them what it's like. It's amazing how it changed my life. It's a miracle. Definitely 100% worth it.
This testimonial relates an account of an individual's response to the treatment. This patient's account is genuine, typical, and documented. However, it does not provide any indication, guide, warranty, or guarantee as to the response other persons may have to the treatment. Responses to the treatment discussed can and do vary and are specific to the individual patient. There is no cure for Parkinson's disease and essential tremor, but there are options available to treat symptoms. The first-line therapy is medication. Surgical treatments are also available. It's important to discuss with your doctor what's right for you, along with the risks and side effects of each option. such as motor fluctuations or permanent neurological impairment. As with any surgery or therapy, deep brain stimulation has risks and complications. Most side effects of DBS surgery are temporary and correct themselves over time. Some people may experience lasting stroke-like symptoms, such as weakness, numbness, problems with vision, or slurred speech. In the event that the side effects are intolerable or you are not satisfied with the therapy, the DBS system can be turned off or surgically removed. Risks of brain surgery include serious complications such as coma, bleeding inside the brain, paralysis, seizures, and infection. Some of these may be fatal. Prescription only. Brief summary. Prior to using these devices, please review the user's guide for a complete listing of indications, contraindications, warnings, precautions, potential adverse events, and directions for use. The system is intended to be used with leads and associated extensions that are compatible with the system. Indications for use. U.S. Bilateral stimulation of the subthalamic nucleus as an adjunctive therapy to reduce some of the symptoms of advanced levodopa-responsive Parkinson's disease that are not adequately controlled by medications, and unilateral or bilateral stimulation of the ventral intermediate nucleus of the thalamus for the suppression of disabling upper extremity tremor in adult essential tremor patients whose tremor is not adequately controlled by medications and where the tremor constitutes a significant functional disability. International. Unilateral or bilateral stimulation of the thalamus, internal globus pallidus, or subthalamic nucleus in patients with levodopa-responsive Parkinson's disease, unilateral or bilateral stimulation of the ventral intermediate nucleus of the thalamus for the management of tremor, and unilateral or bilateral stimulation of the internal globus pallidus or the subthalamic nucleus for the management of intractable chronic dystonia, including primary and secondary dystonia. Contraindications. U.S. Patients who are unable to operate the system or for whom test stimulation is unsuccessful. Diathermy, electroshock therapy, and transcranial magnetic stimulation are contraindicated for patients with a deep brain stimulation system. International. Patients who are unable to operate the system or for whom test stimulation is unsuccessful. Diathermy and magnetic resonance imaging are contraindicated for patients with a deep brain stimulation system. Warnings, precautions. Return of symptoms due to abrupt cessation of stimulation, rebound effect, excessive or low-frequency stimulation, risk of depression and suicide, implanted cardiac systems or other active implantable devices, magnetic resonance imaging, electromagnetic interference, proximity to electrosurgery devices, and high-output ultrasonics and lithotripsy, ultrasonic scanning equipment, external defibrillators, and therapeutic radiation, therapeutic magnets, radiofrequency sources, explosive or flammable gases, theft detectors and metal screening devices, activities requiring excessive twisting or stretching, operation of machinery and equipment, pregnancy, and case damage. Patients who are poor surgical risks with multiple illnesses or with active general infections should not be implanted. Adverse effects. Loss of therapeutic benefit or decreased therapeutic response, painful stimulation, persistent pain around the implanted parts, for example, along the extension path in the neck, worsening of motor impairment, paresis, dystonia, sensory disturbance or impairment, speech or language impairment, and cognitive impairment. Surgical risks include intracranial hemorrhage, stroke, paralysis, and death. Other complications may include seizures and infection. User's guide must be reviewed for detailed disclosure.